Dear friend, I am Dr Hemraj Chandalia. I'll speak to you today about the foot problems in diabetes and primarily how to prevent them. Now we know that diabetes is a chronic and long-standing disease and it leads to peripheral neuropathy, which increases the risk of foot injury, infection and foot complications. In order to avoid those disastrous complications, we'll be looking at different strategies to prevent them in the right time. Now, what are the warning signs that there is going to be a foot problem? So, if a patient has loss of sensation, especially we test vibratory sensation threshold, and if most of the machines, if it is more than 30 volt, remember that the patient may not even realize even if a nail goes through the patient's foot. So you have to keep monitoring this and the other sensation as well. And pain in the legs while walking, especially what is called claudication of calf muscles. This indicates that there may be a vascular problem. The patient has to stop for a while and then start walking again. Change of color of skin may show ischemia or already a little blackening in some places or bluish discoloration. A foot ulcer has a pressure point and lot of corns and callosities. And with the motor involvement of the nerves, you see there is slowly clawing of the feet. And you can see the very gentle clawing is the first thing that starts, and that is indicative that there is already foot problems. Now, what are the causes? Let us look at a little bit detail. Main is the neuropathy. You know the classic neuropathy of diabetes is bilateral, symmetrical, sensory motor neuropathy. Sensory more than motor, but some patients can have a lot of motor element as well. And of course, you see the burning in the feet, and most injuries can go unnoticed, as I told you. So it is very common. The neuropathy part is very rampant in long-standing diabetics, more than 5-10 years of diabetes. Sometimes right in the beginning, there is neuropathy. And various studies show up to 50 to 70% of people involved, depending upon the population they are studying and criteria they use for defining peripheral neuropathy. And then poor circulation, what we call peripheral vascular disease, see, in the legs and in the feet. And this, of course, obviously causes ischemia of the feet. And when there is any injury in the presence of ischemia, the healing becomes extremely difficult and sometimes almost impossible. So you have to safeguard against these problems before they reach this particular state. Also remember that tobacco abuse is another issue, and dyslipidemia, especially hypertriglyceridemia, has been shown to contribute towards the peripheral vascular disease in a significant way, and you must insist on smoking cessation in a patient of peripheral vascular disease. And of course, clawing of feet, which I described for you, and this little bit loss of interossei and lumbrical function, where the toes start getting clawed, and of course, there are corns and callosities, because once the foot is slightly deformed, the pressure points change. And at the points where there is increased pressure, the formation of corn or callosity, which sometimes cracks, and when it cracks, it gives entry to dangerous infection, and which is beginning of the very, very sad events, and that is loss of limb, part of limb, toes, or sometimes even foot, or sometimes even below knee. The present time, by practicing prevention and good care of diabetes and good foot care, I must tell you that we have achieved a situation where sometimes for one decade, with all the patients that we treat at Just Look Hospital, you see foot problem, there hardly anybody who has more than a loss of maybe a toe or so if they come very late. Otherwise, the amputation at any other level, sometimes we don't have for decades. So this shows really the efficiency of doctor treating and educating patients in prevention and how it can be effective in preventing these disastrous problems. Now we go to day-to-day precautions, what the patient should take. So instructions are very important. You ask patients to inspect their feet every day. End of the day, between the toes. Elderly people they are overweight, they cannot lean and see properly anything, and elderly people cannot bend. Some relative has to support by looking at the feet. So, what are the precautions a patient should take day to day in order to avoid these consequences? And what is the foot inspection every day? End of the day, the patient should inspect the feet themselves carefully. If they cannot do it, enlist the help of a relative who can have a look at the feet, and or we use sometimes a foot mirror, a mirror which shows the picture of the sole with a mirror is attached to a stick, telescopic stick, and you can see the foot part little better. Then you should look for any red spots, any abrasions, any cuts, blisters, boils, corns, callosities, and especially shoe bites. And remember, when new shoes are, the patient starts wearing a pair, then there is a possibility of shoe bite. In order to prevent these problems, we have to instruct the patient to take certain precautions on a daily basis. And one of that is they should inspect their feet every day carefully. And if patients cannot do it because of the obesity or impaired vision and impaired physical ability, then somebody else in the family should do it. Sometimes you can use a mirror attached to a long rod in order to see the bottom of the feet carefully. If there are any red spots or abrasions in the feet, they must be noticed and dealt with. Any cuts are there, blisters, boils, corns, callosities, and most importantly, shoe bites. When the patient starts wearing a new pair of shoes, there is a possibility of shoe bite. Then any red or black nails and their whitish patches between the toes. The whitish patches between the toes indicate fungal infection. So if that is detected, it will have to be treated promptly. We also need to instruct the patient about daily foot care. So if the feet are feeling cold at night in the feet, they should wear socks to the bed. This can happen because of peripheral neuropathy. When they trim their toenails, they have to be very careful. If they cannot do again, they should take someone's help. And of course, the toenails should be cut straight across and not go into the live part of the nail bed, and usually do it after a bath when the nails are a bit softer. And of course, there is a good possibility that the area is clean or even sterile if washed properly. And then they should very gently file the toenails with a emery board or with a file. Wash feet daily with mild soap and lukewarm water. Make sure they don't use very hot water any time because they may have lost sensation and they may burn their feet. And obviously the temperature of the water should be tested by dipping their elbow like we do. Babies are given bath. The feet should be dried very thoroughly. If they remain moist, skin invites fungal infection, and the dry skin cracks and invites infection. So skin has to be maintained, neither very moist nor very hard, and this has to be done. Fungal, if there is indication of slightest fungal infection, immediately use some antifungal drops with your antifungal cream between the toes. And of course, this needs to be continued for a long time. Very interestingly, those people who get fungal infections of the feet, they should also put their all footwears in hot sun for about 3 hours or so every week, especially if they use it in the monsoon where the fungus will proliferate with the moisture in the and then apply some talcum powder to the feet, especially a lot of sweating, making it moist. And dry skin, as I told you, cracks easily, so moisturizer has to be used, and especially during the winter time. And of course, a gentle massage of the feet, not very rough massage, will help a little bit in circulation and give some stimuli to the nerves for them to awaken. They must take a walk daily to improve circulation in the leg. But if the circulation is impaired, they will have to take walk only to the extent that the circulation allows. If there is a swelling of the feet, they should raise their feet at night so that at morning at least most of the swelling has subsided. And during the day they should keep their feet up if they are sitting for a long period. If there is evidence of fungal infection, as I told you, you must expose the footwear to hot sun for 3-4 hours every week, because that is very helpful in preventing fungal infection. And of course, there are precautions where a person should never walk barefoot, even indoors. So there is likelihood of injuries with the furniture, even inside the house, furniture, toys, any objects lying on the floor. And of course, they should wear socks and shoes at all times, and do not cut corns or apply corn removers. As is always there is warning on the corn caps not to be used by a diabetic, because it causes a deep wound when the corn comes out. So you use some salicylic acid cream and rub it every day, and slowly that debrides the excessive skin tissue or hard skin. But never use corn caps. And never cut into corners or taper the nails, and never cut nails with a blade, obviously. Never use hot water bottles, heating pads, electrical blankets or cold compresses, as you can damage your feet with the very hot water as well as very cold water. And because there is loss of sensation, the patient may not even perceive that it is very hot or very cold. And of course, as I told you, you can test the water that the temperature is all right before the patient uses. Never soak for a very long time your feet, because it macerates the skin, and that gets very easily torn and gets infected very easily. Not to sit cross-legged most of the time, because it hampers the circulation in the leg. Another important issue is to instruct the patient about the right footwear to buy. And the qualities of a good footwear is that the heel counter is there. So chappals are not allowed. And sandals even without a good heel counter are not allowed. And there should be no forking of toes like it happens in chappals. And also remember that front part of the shoe or toe box should be wide enough, because we all know that feet are actually wider in front than, so this is very important precaution. Now, so pointed toes have to be avoided, and because this really puts pressure and can cause ulcer in the toe, which is starting point of a disaster. So when you walk, you wear athletic shoes and very well cushioned ones, who fit very well, very comfortable, and which distribute the pressure of whole foot very well. Break in the new shoes slowly, because you should not wear the new shoes on the day one for the whole day. Should be for a few hours, and every day increase it and see that it did not cause any blister anywhere or any ulcer because of the pressure there. And of course, examine the feet also, because sometimes the patient don't even realize that there is a small piece of a toy or something in the foot or some other object, and that hurts the foot. Another important precaution to teach to the patient is that they should break in the new shoes slowly. They should wear them for a couple of hours on day one and gradually for a longer period of time. They should also examine the footwear carefully once in a while for any torn linings, for any foreign objects lying there which they not have realized because of loss of sensation. And the socks, as far as socks are concerned, they should wear seamless socks, cotton socks, and avoid anything like those synthetic socks which will increase the sweating in the foot. They never use any very tight footwear, and because it may constrict the circulation. They should avoid exercising when they have any sore on them. They should really use only the upper body or non-weight bearing exercises whenever there is a fresh problem in the feet. And preferably buy a new footwear in the evening time, because the feet get slightly swollen in the evening, so that if you buy in the morning, you may find later on that they get tighter by evening. So I think with these preventive steps, you will be able to prevent the final disaster, which is a loss of limb in a diabetic. And this preventive strategy works very well, because inevitably a long-standing diabetic will have loss of sensation in the feet and sometimes compromised circulation. In spite of that, those who are well instructed, educated, and very hygienic people, they do not result in any disaster like loss of part of the limb or loss of the whole limb. Thank you very much for your patient hearing.